When you hear a newborn breathing, it's usually quiet and soft. But for some babies, their breathing sounds a little noisier, like a squeak or a rasp. This can be due to a condition known as laryngomalacia, which is one of the most common causes of noisy breathing in babies. Before starting, we encourage you to hit that subscribe button and turn on notifications. What is laryngomalacia? Laryngomalacia is a condition where the soft, immature tissues of the larynx, voice box, collapse inward during inhalation, partially blocking the airway. The word laryngomalacia literally translates to soft larynx, which reflects the nature of the disorder. As a baby breathes, the floppy tissues around the larynx fall inwards, making the breathing sound noisy, often described as a high-pitched squeaking or stridor. This condition generally presents itself in the first few weeks after birth, and though the sound can be alarming for new parents, laryngomalacia is usually a benign and temporary condition that resolves on its own as the baby grows. How common is laryngomalacia? Laryngomalacia is actually the most common congenital laryngeal anomaly and the most frequent cause of stridor in infants. It affects approximately 1 in 2,600 to 1 in 3,000 newborns. Most babies with laryngomalacia are otherwise healthy, although in some cases, more severe forms of the condition may be associated with underlying disorders such as gastroesophageal reflux disease, GERD, or sleep apnea. Symptoms and causes. The primary symptom of laryngomalacia is noisy breathing, particularly during inspiration, when the baby inhales. This noise, known as stridor, typically worsens when the baby is excited, crying, feeding, or lying on their back. In most cases, the sound peaks between 4 to 8 months of age and then gradually decreases as the larynx becomes stronger. Other symptoms can include difficulty feeding, poor weight gain, cyanosis, turning blue during feeding or breathing episodes, apnea, pauses in breathing, gastroesophageal reflux. The exact cause of laryngomalacia is not well understood, but it is believed to result from a combination of anatomical and neurological factors that cause the larynx to be softer or more pliable than usual. In some cases, GERD can exacerbate the condition, as stomach acid may irritate the tissues in the larynx, making them more prone to collapse. Diagnosis and tests. If your baby has noisy breathing and laryngomalacia is suspected, your pediatrician will likely refer you to an ear, nose, and throat (ENT) specialist for further evaluation. The diagnosis is typically made based on a combination of the baby's history, physical examination, and a procedure called laryngoscopy. Remedies and treatment. For most babies, laryngomalacia is a self-limiting condition that resolves on its own as the baby's airway matures. This usually occurs by 18 to 24 months of age. In the meantime, parents can help manage the condition with some simple remedies. Positioning. Keeping the baby upright, especially during feeding and after meals, can reduce the pressure on the airway and help with breathing and reflux. Feeding adjustments. Smaller, more frequent feedings may help prevent reflux and reduce breathing difficulties. In some cases, thickening the formula or breast milk can also help. For babies with mild to moderate laryngomalacia, these measures are often enough to manage the symptoms until the condition improves. However, in about 10 to 20% of cases, laryngomalacia can be more severe and require medical intervention. If your baby is experiencing significant feeding difficulties, poor weight gain, or sleep apnea, surgical treatment may be necessary. The most common surgery for laryngomalacia is called supraglottoplasty, where the floppy tissues are trimmed or reshaped to prevent airway obstruction. Subscribing to our channel is the best way to stay up to date on our latest content and receive notifications when new videos are posted.